I'd like to start with Dr. Shah, and say, what exactly do you plan to do or hope to do with the Rockefeller Center's muscle and largesse?
Well, thank you so much, Jillian. It's nice to be with you and to all of you that have joined for this conversation. We brought together a group of scientists, industry experts like Mike, mayors, and governors who we work with and have worked with for a long time, like Francis Suarez and so many others, and tried to understand, are there a set of practical, pragmatic actions our nation can take to scale up testing? And the reason we focused on testing was it really is the only way out without having a vaccine or an easy therapeutic, neither of which seem readily available, to reopen parts of our economy and avoid the ricocheting between either being fully shut down and therefore safe, or being active in the economy and therefore at tremendous risk of rebound COVID-19 pandemics. And when we looked at the data, we identified a set of targets that I think are quite instructive, and we call our plan the 1-3-30 plan to make it really straightforward. Right now, America is stuck at about 1 million tests per week. We've been stuck at that level for the last 3 weeks at least, and it's not scaling up fast enough to safely reopen parts of the economy for essential work. We believe we need a minimum of about 3 million tests per week. And we think that's achievable in just 8 weeks. And I know Mike Polini will describe why, but it centers on the basic observation that 2/3 of America's molecular testing capacity resides in university labs, research labs, and small labs that are really not part of the national CDC diagnostic and surveillance system. And that molecular testing capacity needs to be brought online urgently. And those labs need to be a part of the strategy to get us from 1 to 3 million in just 8 weeks' time.
So I'd like to turn now to Dr. Mike Bellini. You're in a very interesting role and you have a lot to say on this topic. You're working with the Rockefeller Center to try and bring this out, but you are a trained physician. You have been in medicine for more than 20 years in a series of senior roles at different companies involved in clinical diagnostics and genomics. I won't run through your extremely impressive biography, but you have basically seen what it's like in the private sector to try and roll these types of responses out. Um, how realistic is it going to be from a medical perspective to actually get this done?
One of the challenges that we're facing is that this is an industry, the diagnostic industry is one that has in many ways been left behind, at least from a policy standpoint, from a payer standpoint, from a regulatory standpoint for decades now. And so when this COVID crisis hit, to ramp up diagnostic testing, we weren't starting the game at 0-0. We were in fact behind 28-0. And we had to catch up before we could even make progress. And let's keep in mind, unlike the vaccine challenges, unlike the therapeutic challenges, the diagnostic challenge is not necessarily one of innovation. It's not one of research. It's not one of discovery. It's actually one of coordination. It's one of financing. It's one of partnership, both partnership between organizations, public-private partnerships. And so reframing the challenge, it's not about true innovation, it's about coordination, partnership, and financing. And that really gets to the heart of the issues that we're focused on through the Rockefeller Foundation. One of the reasons that we need better access to data is because within any given state, within any given region, there are laboratories that have excess capacity of 80%. They're only receiving 20% of the tests that they could actually run in any given day. Yet right next door, there are laboratories with turnaround times of 5, 6, 7 days, and they've tripled their capacity. They might be 30 miles apart from one another. So what's happening? What's happening is that the providers, the healthcare providers who are ordering those tests, don't have visibility into the system. So if as a third component of the plan, as we generate this information and we develop local dashboards to match up capacity with demand, truly on a daily basis, which, by the way, is the way that most organizations in the world function, we enable these healthcare providers to make appropriate real-time decisions so they know where to send the samples. And in fact, we believe we can do that in an automated fashion. So if we focus on, if we get into the weeds, which is where we have to get to with laboratory tests and the way this industry is structured, we can start to peel things off one at a time, focus on financing, focus on centralization of decision making, and focus on dashboards so we can make appropriate decisions. We will see a dramatic uptick in testing in the United States.
So I'd like to now turn to Mayor Suarez and ask you how it looks on the ground from the perspective of someone who's running a vibrant, wonderful city that we all hope gets back to normal as soon as possible so we can have a vacation at some point. And in particular, I'm curious, I mean, you had COVID. I hope you're now doing better. How did you get a test? How did you find out that you've been infected? And what can you do to roll out that experience across your region?
I actually had an interesting experience because I was receiving a delegation from Brazil, with the president of Brazil, who had been with the president of the United States the weekend before. And it became public later that week on March 12th that one of the members of that delegation had tested positive for COVID-19. You have to understand, you have to take yourself back to that time. This was really at the beginning. And it's so much so that on March 12th, the day that I found out that I was in a room with someone who had been positive a few days before, I had to make my state of emergency declaration remotely because my fire chief and our medical director had asked me and I had obliged to voluntarily quarantine myself immediately upon understanding and realizing that I had been in close contact, close proximity with someone who was COVID positive. I was completely asymptomatic. So immediately I had to go public. I went public within essentially the hour from finding out after notifying my family. And I became probably the first elected official in all of the United States that had diagnosed positive. The second case in Miami-Dade County, and a little over a month after, we had 11,000 cases and over 300 deaths in our county.
Raj, I'll just come back to you and say, you've put a plan forward. There's a price tag on it. There are all sorts of issues. You've got a team of contributors to the report and a plan. What's next and what do you need?
At the end of the day, we have an action plan that has some core components. The first is we do need the federal government, we believe, to adjust its reimbursement for tests so that it applies to labs that are in network and labs that are out of network, including the underutilized, research and the small institutional labs that exist in our country that are holding a lot of that capacity that's not currently being fully tapped. I think a second thing we have suggested and Mike spoke about in some detail is we need to have a emergency procurement facility so that labs and cities and states can come together and place larger, longer term purchase orders with some financial backing from banks, from foundations, ultimately from the federal government. So we take the risk out of placing larger long-term orders. These are all really specific actions, some of which we're starting to already see take place in the bill that was passed just recently. Because there are ongoing stimulus and response pieces of legislation, it is my hope that this can move relatively quickly. And the $100 billion price tag, which at the time felt perhaps like a lot, we've already made a $25 to $30 billion initial investment. The $100 billion is for the whole year. About $80 billion of it is in the $100 per test reimbursement structure we've proposed, and the rest is for the workforce effectively. So we feel like the country is going to and needs to spend this resources. Now it's about doing it well and doing it in a coordinated way and overcoming the challenge of what is otherwise a very disaggregated industry.
What is the current situation on the ground in Miami if you want to get a test tomorrow? If you're an ordinary person who says, I want to get a test, can you or can you not? And how do you imagine it would work to, say, mobilize the Peace Corps or the Reserve, National Reserve, or someone like that to try and get this done? I mean, do you think that you could actually implement in your own backyard what Dr. Shah is talking about?
Yes, we think we can. Right now, if you are symptomatic, you are essentially guaranteed a test for free and you'll get it essentially next day. We now have gotten to the point where we are sort of graduating from symptomatic testing to asymptomatic testing. That's not something that's happened up until this point.
The major laboratories run about 40% of what are called molecular tests, of which COVID PCR test is one. They run about 40% of the tests in the country right now. There are 60% of laboratories that have the ability to run COVID testing, and they may be running it, but they're not part of the network. If we can bring them online overnight, we increase our tests available by 2.5 times. So just by doing that, we go from 1 million tests per week to 2.5 million tests per week. Clearly, we can't do it overnight, but we can absolutely do it within this 8-week window. And so again, there's a regulatory challenge, there's a reimbursement challenge, but let's not lose sight that this is not an or solution. It's not, let's build up research, let's build up national testing, let's build up academia testing, let's build up home tests. This must be an end solution. The only way we are going to scale dramatically is by ironing out the logistics, fixing payment, centralizing decision-making, but focusing on all of the testing options as well.
Thank you again to our panelists and to Jillian Tett, and we look forward to following through on the next conversation. Thank you for joining us today.